Hello, everyone. I'm Maurice Jones, Chapel Hill Town Manager, and we are here to provide an update on our community's response to the COVID-19 pandemic. Orange County and the town of Chapel Hill are now under North Carolina's phase 1 of the stay-at-home order. Generally, there are few changes in this new phase. A number of retail shops are now open, but restaurants and bars remain closed for the time being, and mass gatherings are limited to 10 people or less. Physical distancing remains an important component of our efforts. With me today are Dr. Adam Goldstein of UNC Family Medicine and Kelly Drayton, the town's emergency management coordinator. Dr. Goldstein, the science shows us that as difficult as all of this has been, physical distancing and altering our work and personal lives have helped reduce the spread of the coronavirus. Many people are eager to get back to normal, get back outside, and otherwise gather with one another again. How important is it to ease back into what we used to call normal and not undo some of the progress that we've made?
Thank you, Maurice. This is a critical question in a critical time. Ease does not mean easy. And when we want to go back into doing some things that we haven't done, it's not all everything or not at all. And in medicine, we like to say we like to go slow and safe. And that's the conservative approach that we should be advocating for the public, because it will allow us to do the things that will protect us. We mentioned the physical distancing and the hand washing, things that we've been doing now for several months that will continue. But we also have to have systems in place that allow us to get tested when we need to get tested, that we have contact tracing for those that do get infected, and quarantine if one's been exposed. These are all the responsible things that we must do to ensure the public safety. And we've heard time and again from the public health authorities in North Carolina that that is what we will do. And that's the safe and responsible thing to do.
Many medical experts have discussed the possibility of COVID-19 numbers climbing again in the fall and the winter during the cold and flu season. I'm sure a lot of what we've learned this spring will be helpful in preparing for that possibility. What are the most important steps people can take in their everyday lives to prepare for a possible reoccurrence of an outbreak later this year?
Well, one of the things we've been doing now is one of the things that we should really continue doing, and that is wearing masks. We know that a face covering does offer some protection, particularly from us giving it to others, our loved ones. That's really what we're trying to do, and that's going to continue for the indefinite future. It makes people feel more comfortable when they are around others that are doing the common protection. One of the best things that we can do to avoid giving COVID to another person, as well as giving it to ourselves, is proper sanitation. And that really includes hand washing, and when we need to be wearing a mask. Hand washing prevents, particularly if we don't touch our mouths, us actually touching the COVID and bringing it into our own bodies. It also prevents us from, if we have it, from giving it to others. The same would go with the mask coverings. These are both common sense approaches to public health that the CDC, our Department of Health and Human Services, and public health officials all agree on. The last thing is that our behavior in public can also reflect the heightened sensitivities. We should be more aware and sensitive of when we're touching any others, when we're in other space, the kissing and hugging that we may do in our communities of faith. These are things that we probably will be doing much less of in the times that we're living now until it's safe to do so. Large outdoor or indoor spaces with large numbers of people in close proximity, those are things that we're going to be much more hesitant to do, if at all.
The town is trying to take a measured approach to returning services to normal in an effort to avoid prolonging the state of emergency. Kelly, for all of us, this coordination starts with our medical experts before any of our decisions are made. Can you tell us more about our efforts and how we consult with medical experts to make decisions about moving forward?
Yeah, absolutely. We have invaluable resources in our community, including Orange County Health Department and UNC hospitals, on which we rely for critical and timely information. And we aren't making any decisions for our staff or the public without verifying with those subject matter experts that those decisions are first rooted in science and second promote health, safety, and welfare of our community. And there may be some decisions in the future that we make for our community that are more restrictive than other areas. And we appreciate the community's patience as we work through those decisions.
And the town's department directors have been meeting regularly to think ahead so that when we are ready to reopen our town services, the processes will already be in place to help protect folks. Is that correct?
Yes, absolutely. All of our departments have been working diligently to think ahead about plans for reopening. And much like the state's reopening, it's likely that our town services will be gradually phased back in. And we've started doing some of this already. The library's piloting a curbside pickup this week and working on ways to start collecting and sanitizing materials that have been checked out so that they're not all returned at once. And our Parks and Recreation is reviewing ways to utilize their facilities that promote healthy behaviors while still keeping in mind all of the applicable guidance from health and medical professionals. And our transit is considering when and how to restore routes and schedules.
Dr. Adam Goldstein and Kelly Drayton, thank you very much for your time today.
Thank you.
Well, the steps we take will help us move forward, move closer to reopening as a society and as a community, and to do that safely. So we ask that you please continue to practice physical distancing, at least 6 feet apart from the next person beside you. And of course, as we've been saying since the beginning of this whole thing, since the beginning of the pandemic, please wash your hands often to keep the spread minimal. So the science is showing us that these steps and staying at home has worked and continues to work. So we thank you for your patience, and we thank you for working collectively for the benefit of all of us. Until next time, take care.